Healthier Together, sponsored by Regents Blue Cross Blue Shield of Oregon.
May is Mental Health Awareness Month, and now more than ever, it's important to talk about it, especially with our kids. Here's Senior Medical Director of Behavioral Health at Regents, Dr. Mike Franz.
It's a national issue, but it's also a specific Oregon issue. In fact, it's even worse in Oregon.
Mental Health America's annual report shows Oregon ranks as one of the worst states in the U.S. when it comes to mental health. That's prevalence of mental illness and access to care. We're only ranked higher than Kansas. And when it comes to the mental health of our youth, we're dead last.
So we've got our work cut out for us here.
The pandemic has had a huge impact on kids and teens. Dr. Franz says the disruption in their routines led to more isolation. That often led to more screen time and social media use.
There's increasing evidence that over the pandemic in particular, the use of social media led to such issues as cyberbullying and really idealistic images that weren't realistic in regards to body size, body type. We saw increased prevalence of eating disorders really spike during the pandemic.
And he reminds us adults that kids are not immune to what's going on in the world around them and how we, the grown-ups, deal with it. They're worried about the future. Things like climate change and the political divide have an impact on our kids.
And then there's the mass shootings, that we read about almost every day now. And there is a direct correlation between mass shootings, exposure to that, awareness of that, and kids' mental health status. And we as the adults and as the leaders need to take action to try to address that.
So what can you do as a parent, caregiver, or family member? Well, the first thing is just being aware. Listen and pay attention.
If you see changes in your child's routine with their sleeping, with their eating, with their energy level, there's more tearfulness. For your younger kids, if there are more body complaints like stomach aches or headaches, these could be warning signs that maybe they're struggling a little bit.
Dr. Franz says when talking to your kids about their mental health, it's important to be present. Ask developmentally appropriate, open-ended questions.
Hey, I've noticed that maybe you have seemed a little more quiet lately. Anything you want to talk about? That's a way to open the conversation. Don't be directive. Don't unload your own stuff on them, but just be available and then connect them to care if they need it.
And that can start with your primary care provider.
Kids are really resilient, so I'm optimistic. I'm confident that they are going to come out of this okay, but it doesn't let us off the hook for doing what we can do now to affect public policy, the healthcare delivery system, and address those issues that we can as adults.
Find more information and resources for talking about mental health with your family at kgw.com/healthiertogether.